So I'm Dr. Colleen. I'm one of the veterinarians with the National Shelter Medicine team for Best Friends. Today, we are going to chat about expanding veterinary access in shelters. We're going to talk about some creative models that drive life saving. So I will probably say some things today that challenge maybe your current thoughts or beliefs or how you do things, or that are different from the way you've always done it. And so the question I want you guys to keep thinking about throughout this presentation as you're feeling challenged or exposed to new ideas is what would a world look like where every animal in an animal shelter had access to veterinary care? And what changes would you be willing to make that happen? So our agenda, what are we going to talk about today? This is the part where I tell you what we're going to talk about, and then we talk about it, and then we talked about what we talked about. But we'll go over the current state of the veterinary shortage that I'm sure you all live and experience every day. And then we'll dive into solutions. So we'll only spend a minute talking about the current state. And the rest of the presentation will be solutions oriented. So we'll talk about leveraging staff and volunteers. We're going to talk about how we can use protocols and veterinarian of record programming. We're going to talk a little bit about telehealth. We're going to talk a little bit about AI and what's currently available to us and how the next year or 5 years, there might even be more things available. We'll talk about shared care networks. My favorite topic, contextualized care. And at the end, I will tell you what you're all here for, which is how do I find a vet? So the current state. Mel, one of the technicians on our team, is going to be dropping some links throughout the presentation in the chat. And so some of them are papers related to what I'm talking about so that you know that I haven't made it up. And other things are resources. So you can kind of look there for some of those links as we're chatting. And then at the end, we'll put all the links together so that you have one little resource bank for them. The current state of veterinary medicine in animal shelters. So this was a paper that came out a couple of years ago now, and it informed us what we were all feeling was true. So about 3/4 of animal shelters and access to care clinics are facing shortages of vets, or they feel that they are. 84% that currently have a vet position can't currently fill it. 91% of shelters and access to care clinics have a spay and neuter backlog. And some of the estimates around how many surgeries this is are around 3.5 million. And this was a couple of years ago when we're looking at compared to COVID. It's probably even a bit higher now. And so this is our current state. We have some work to do to get caught up and to get some of these positions filled. I love this map. Mel will drop a link to this website as well that looks at access to care around the United States, and it goes county by county and it assigns it a score. And I'll tell you, this score is based on lots of things, not just the number of vets and the number of people, although that does give us one piece of information. It also looks into other things like what percentage of people have a reliable source of transportation, how many people live below the federal poverty line, and other factors that contribute people's ability to get to the veterinarian. This does not exactly represent shelters, but what I will tell you in my lived experience is it's pretty darn close. And so everywhere we have an access to care crisis for the public, most of those shelters have the same sheltering crisis. The red in particular, many of those counties don't have any veterinarian at all. And so if you're a shelter that has veterinarians, I would like you to imagine a world where you had to run your shelter without a veterinarian. And I'll tell you, there are many, many, many hundreds, thousands of shelters that do it. And it kind of helps us keep perspective around what we're doing in our day-to-day. The first solution, and potentially the most important solution, I think, in this entire presentation, is that we're leveraging staff and volunteers to the best of our ability. And so the first piece of this is every person at the shelter should be practicing at the highest level their license allows. And so what this means is that veterinarians typically don't need to be giving vaccines or cleaning kennels. Technicians typically don't need to be cleaning. How can we make sure that no one is doing something that they don't need to be doing? So leveraging everyone to the highest level their license allows. And this is an interesting statistic that floats around veterinary technician utilization. So the estimate is that about 30% of veterinary technicians' skills are utilized in most veterinary practices. And so what this tells us is that we are not asking our techs to do the tasks they're trained to do. And the more we can utilize veterinary technicians, the more we can free up veterinary bandwidth. The other side of this is that when people are not using all of their skills, it can contribute to burnout. So if you have invested in your skill set as a veterinary technician or as a veterinarian, and you spend a lot of time doing things that other positions could do, it leads to a sense of burnout. The important thing in this title, when I say leveraging staff and volunteers, I try to say it the same every time because I think about how often we underutilize volunteers. And so there is almost nothing that we can't train a volunteer to do that we could train a staff member to. I think when I think about volunteers, I think about like a promotion system, right? So there are volunteers that I can trust are going to show up regularly. I can trust that they want to do a good job. And sometimes the volunteer status can get in the way of us trying to teach them more things. But I think there is a real opportunity to leverage our volunteers as well. So I think about what can support staff do, and I would bucket volunteers in here as well. Oh, also, I didn't say this at the beginning, but I think it's important to mention now. I've sprinkled in cute photos of my own patients all throughout this presentation, and I tried to pick the cutest ones as a holiday gift to you all. So this domey-headed little puppy is just so freaking cute. I had to share. So when I think about what support staff can do, the answer is almost everything, right? So intake exam. Sometimes we'll go to shelters, and this is something veterinarians spend a lot of time doing. And I would ask the question if that is the best use of their time. Vaccines, preventatives, they can execute protocols, and we're going to get into that in a lot more detail in a little bit. They can do things like initial triage and assessment. And I will tell you, I've taught all sorts of different people to do initial triage and assessment, whether it is a volunteer or a staff member or someone with formal training or without formal training. If they're given the right tools in their toolkit, this is absolutely something a support staff or volunteer can do. Collect vitals and photos or video, collect samples and images, set up for procedures, and some minor procedures they can perform. Data entry, rechecks. So a patient that already has a diagnosis, already has a treatment plan, rechecks can often be done by support staff and volunteers. Foster appointments, communication with other shelter departments, communication with clients. I will tell you, I do almost none of this because I give it all away. And I encourage all of my support staff to do the same. There are times where having a veterinarian in the room is really helpful. And so I don't think it needs to go away completely, but every day I encourage veterinarians to look at what am I doing that I don't need to be doing? Inventory and control drugs as well. Here's my volunteer highlight. This is Lori. She is a anesthesia recovery volunteer. She is amazing. I trust her to take care of all of these puppies at the same time. And I bring her up because there are staff in this building, and I trust sometimes Lori as a volunteer to oversee those staff. And so I just think sometimes the title can give us pause as far as what responsibilities we want to delegate. But but Lori is a retired nurse. Lori is very good at understanding anesthesia and administering vaccines. And so when I think about who can I pull in to my shelter to be helpful, I really love this bucket of retired nurses, but also students that think they may want to go into veterinary medicine are a good pool to recruit from. And those are my two favorite buckets, if I'm being honest. But I do think that you can teach volunteers lots of things, and we can give them responsibility over time as they show us they can do a really good job. So, what can only the vet do? So, if I've given away all of the vet work, what is left? And it's really, there's not that many things where really truly a DVM needs to be doing it. And so I included this first piece as write or approve SOPs. And so we'll get into some of that in a little bit. And there's even some nuance here. It depends on what's in the SOP. But particularly if we're treating infectious disease or if we're treating a diagnosed problem, then we want a vet to oversee that protocol. And we'll talk about that in a bit. And I wrote write or approve because we're going to give you some resources in a bit where the veterinarian might not even need to write them. Surgery and pre-anesthetic physical exam and diagnosing and prescribing if it's not in a protocol. I also include that this when I'm talking about what the vet needs to do versus the veterinary technician or support staff, I am talking about the animal shelter population, and it gets a little more complex if we're talking about publicly owned animals and things like that. When I think about different types of veterinary relationships, I just like to lay this groundwork because sometimes we have only looked at veterinarians in a certain way. And so I encounter this quite a bit when working with shelters who have kind of always done it a certain way. And I explain that there are different types of relationships we can have with shelters and vets. And so I just wanted to give a brief overview of a few examples. There are more, but here's a few places to start. So staff, that's like your classic. I have a veterinarian who works for my organization, and they may be full-time or part-time, or some other creative agreement. But typically, that is someone who works for the organization. So oftentimes, shelters think they want or need this, but I think it's important to explore all of the different types of relationships shelters can have with veterinarians aside from hiring their own vet. So a contract veterinarian can look like all sorts of different things. Sometimes contract veterinarians are just contracted to do spay and neuter. Sometimes contracted veterinarians are just contracted to see patients a certain day of the week. It can look like a lot of different ways. But I think when I think about where can a shelter start, sometimes it's with a really small contract for a vet that comes and does some of their medical care. Vet of record. A vet of record, we'll go into more detail in just a couple slides, but the idea behind a vet of record is a vet who has agreed to let the shelter order medications under their license in exchange for oversight of what happens. And there's lots of different ways to have a vet of record. We'll go into that in more detail in a minute. Client of a practice, we'll also dive into this one a little bit, but this is your most classic relationship where you have one sick animal and you bring one sick animal to a veterinary practice and they are seen, diagnosed, and treated on an individual basis. There's some other opportunities here, I think, when we think about being a client of a practice, and we're going to explore that shortly. I wanted to introduce this idea of a veterinary client-patient relationship because it's something vets think about a lot. And I don't think that non-vets think about it very often, but I think it would be helpful for everyone to have the same background information about what this means. So we use the acronym VCPR to describe this type of relationship. And it's the legally required relationship that ensures a vet knows the animal well enough to safely guide its medical care. And so this is what gives us the legal basis to say, okay, I can give you direct medical advice and treat a pet. And as a part of this agreement and relationship, we meet these criteria. So the veterinarian is responsible for diagnosing and treating the patient's health. The client agrees to follow the veterinarian's instructions. The veterinarian has enough knowledge of the patient to make a preliminary diagnosis. The veterinarian is available for follow-up care. And lost my screen there. I think I repeated it twice there. Yes, I made a slide goof. So, and the veterinarian is available for follow-up care. So how do we establish this? I will tell you this looks a little different for different states. I pulled the definition from Utah, which is where I live. And to establish a VCPR, we require in-person consultations or examinations or through medically appropriate visits to the patient's care location. And so for shelters, VCPR is often with the facility and the owner, which if anyone is familiar with large animal medicine, such as like cows and horses, this is much more common. And so they're familiar with the protocols and the practice in the facility, and that helps establish this VCPR. In some states, it can be established virtually, and we'll go over some of that when we talk about telehealth. And it really varies by state. So I encourage folks that are beginning to dive into this veterinary relationship wormhole to pull up your Veterinary Practice Act, which are usually available online, and it helps define some of these terms as they're seen in your state. So a relationship type. So I wanted to talk a bit more about vet of record, because I think it can be one of the most useful tools for shelters. And some shelters have a vet of record, but they're not leveraging them to their full capability, or they haven't established any sort of formal agreement. So I wanted to explore what these types of relationships can look like. So if you look at a definition of vet of record, it is an unregulated business agreement between an animal shelter, veterinarian, and veterinary distributor. So there's a bunch of acronyms in here, and I'll read them as to what the words are, but there's lots of letters on the screen. So the vet of record allows an animal welfare organization to use the vet of record's vet and or DEA licenses to order drugs and medical supplies. The vet of record oversees their use even when they're not present. So the idea is a shelter can use the vet's license, and they've come to an agreement around what it will be used for and how it's going to be used. This is one of the coolest, I think, things that have come out in access to care for shelters in the last few years, and it's the Shelters United Vet of Record Toolkit. And so Mel will drop the link to this in the chat. And so it is exactly what it says. It's a toolkit, and there's all sorts of different documents and examples of what vet of record can look like, including sample contracts and what types of things veterinarians might cover. They also have a 1 hour free CE that goes into a lot of the nuance of vet of record. And so if you're either a veterinarian who's interested in pursuing vet of record contracts in your community, or if you're a animal welfare organization who is beginning to explore this further, or if you want to leverage your vet of record relationship more, I think this is a great place to start. So one of the core pieces of a veterinary relationship, I think, and I think this can apply to several different types of relationships, is the idea of having a memorandum of understanding, which is a big fancy bunch of letters to say that we have agreed upon a set of conditions and we both agree to it in writing. And so some of the value with having an MOU with your veterinarian of record, or even if you're a client of a practice, is that we can clarify roles and responsibilities. And this can really happen on both sides. So agreeing to what the veterinarian is responsible for, agreeing to what the shelter is responsible for. And it helps us ensure compliance with regulations. So if we all have the same agreement about what is going to happen in the next 12 months, it can help us make sure that we're staying compliant. MOUs also typically talk about money, and so outlining financial arrangements in detail, and it helps shelters plan for how their money is going to be spent in the next 12 months, and it helps vets understand how much they could expect from the shelter. And I think by having this baseline of communication and coming to a mutual agreement, we can foster successful collaboration and communication. When we think about MOUs, and if you don't have one with your veteran record, I do encourage folks to look into it because I do think it's this opportunity to expand what that relationship looks like. And it should be reviewed on some sort of regular basis, so possibly yearly, to make sure that everyone is still okay with the arrangement and that it's serving everyone. So when I think about veterinary relationships, we want to make sure that everyone is feeling fulfilled by the relationship. So when we have a vet of record, and even if we don't have a vet of record, and even if we have a veterinarian on site, we try to think about how we can streamline all of the processes in the shelter so that we can shift routine decisions to trained staff. So protocols can also help us standardize care and improve safety. They enable some telemedical support, and they can help us build a scalable system. So there can be all sorts of different protocols in your shelter, right? You may have protocols for how the animal is entered into the shelter management software. But when we think about medical protocols, oftentimes we can treat our most common shelter diseases through a series of criteria that lead the staff to a treatment plan. And so when we have a vet of record, we can use the vet of record to approve pre-written protocols or write them they can write them themselves if they're interested in that. And if we have a vet on staff, it's potentially even more vital to preserve their time and scale up what they're able to do by handing off some of the routine decision making via protocols. We have templates, so I keep talking about how your vet doesn't have to write them. And so Mel will drop a link to some of our templates in the chat. When I think about how I would recruit for a vet of record, I think one of the most effective strategies is going to veterinarians in your community with a pre-arranged approach, right? So if you have already drafted an MOU that makes sense for your organization and you've already collected a lot of templates for different protocols you want to use, it may be easier for a veterinarian to be invited into your shelter and see if this is an arrangement they would like to engage in. So we want to make it as easy as possible to foster that relationship. The next relationship type I wanted to dive into a little bit further is client of a practice. So typically, this involves individualized patient care. So like the typical vet you may take your pet to. They typically do not oversee protocols or distribute medications for population level care. One thing that I think is an opportunity for shelters is to still explore this idea of an MOU. And so this is coming up with an agreement with a local veterinarian for things like number of procedures or routine visits allotted per month, or things like an agreed on approach for common scenarios. So you might take some of these protocol templates and see if any veterinarians are willing to work with you on how let's give the example of a feline upper respiratory disease would be treated at that clinic. This is a careful dance. Oftentimes, what we want to be careful of is that we're not telling veterinarians how we want them to practice. That is typically poorly received. And so how I like to frame this is framing it within a budget of how much money you're able to spend and what you envision the best stepwise approach would be. I think this can be really helpful if you have an existing relationship with a veterinarian and you're trying to formalize processes and procedures for your shelter. But there's lots of different ways this can look. So I just encourage folks, like just because the only veterinary access you have is the vet in town that you take one kitten to every month, maybe. It doesn't mean that you can't formalize a relationship with them for agreed on approaches or the number of procedures, whether it's spay and neuter or whether it's sick and injured appointments that clinic is going to see. So when we think about how we can encourage veterinary practices to work with our shelter, there's a few different ideas here, and there's a lot more. These are just to kind of get your wheels turning. So service bundles, so the idea of individuals versus package deals for routine care. So say we know we're going to take 100 cats in a year to a particular practice. Is there a deal we can make around how many animals would be treated? And can we bundle things together that we know we're going to need? Trade value, so offering something to the clinic in exchange for discounted rates or for service bundles. And sometimes this can be things like visibility on social media, community recognition. We've even used things like staff training in exchange for discounted rates. And so oftentimes this is in things that sometimes shelter folks know a lot about, like spay and neuter, in exchange for what we need from a general practice. And in the back of our minds, we're constantly thinking about how we can leverage in-house capabilities to reserve funds for things we cannot handle in-house. Telehealth, this can be a kind of heated subject, interestingly. And so telehealth is this idea that some things can happen remotely. And so it expands veterinary access by allowing remote triage, case review, and decision making when a veterinarian isn't on site. And so when I initially say telehealth, typically the thing everyone is thinking about is some sort of service you can call, and those exist. But telehealth can also just mean that a veterinarian is triaging things over the phone, or a vet tech is triaging things over the phone. And it helps us make decisions when the veterinarian isn't there. Telehealth also helps us reduce bottlenecks through rapid evaluation of common conditions. So if the staff can act under protocols and escalate via telehealth when they need to, it helps us reduce those bottlenecks. It can give us access to veterinarians, even if you don't have a veterinarian in your community. So one of the I think most valuable uses of telehealth is if we think back to that map, all those counties that are in the red, where there may not even be a veterinarian in the county, how can those pets still receive care? So when we think about telehealth, we're thinking about whether or not a diagnosis can be made. So like teletriage is this column on the left, and telemedicine is this column on the right. And so when we think of teletriage or kind of these like vet advice, telehealth companies, oftentimes they can help make a decision about whether or not a pet needs to go to the vet, but they cannot make a diagnosis. They cannot make a specific treatment plan or prescribe, versus telemedicine can. And so I think the important thing to mention here is this box about can engage without a VCPR. So this is a hot topic in veterinary medicine right now, is when can a VCPR be established virtually? And right now it's kind of been left up to the states. So on the next slide here, Mel will drop a link to this virtual veterinary care map. And this is an interactive map that tells us what is required for a VCPR to be established in a certain state. And realistically, every single state is pretty much different right now. But this map is helpful for that reason. In some states, VCPR can be established virtually. So when I think about the opportunities here, right? So the pet doesn't need to be seen first. And in those states, we can leverage telemedicine even further because we can achieve a diagnosis and treatment plan without an in-person exam. And so there may be additional opportunities in those states to move beyond teletriage into telemedicine. And I think we're going to see a lot of change in this this arena in the next couple of years. Um, and honestly, I do think we're going to see more states added to virtual VCPR can be established. And so I encourage everyone to pay attention to this space and figure out if you are in a state where it can be established, how we can leverage telemedicine the most. AI tools, I think this is an important piece to add to the conversation. The world of AI is rapidly developing in front of our eyes. And while I think it's important to be judicious about how we use AI, and uh, I do think it's here and it's here to stay. And if we can leverage it in our favor, it's going to help expand the amount of work we can do in a day. So the the most broad use of AI right now are these language models, and I'm sure most of you are familiar with ChatGPT. And there's other language models as well that can help do some more of this language communication bit. One thing I use AI for almost every single day is assist in paperwork and communication. So when I think about this use for a veterinarian in particular, it can help streamline things like formulating client communication, formulating emails, drafting responses to things, all of those things. But there's also more specific veterinary uses, veterinary specific tools that are AI. The most popular one is Covet. And so that can do things like write up your soap notes and make sure that your medical records have everything they need. And it can do some of those checks for you, but also some of those formulations. Triage and protocol interpretation, depending on what AI tool you use, we can teach AI things, which is frightening for some, exciting for me, but we can teach certain AI models what our protocol is and have AI assist our support staff in interpreting that protocol and making the next best decision. When I think about AI tools, I kind of think about them in the same way that I think about support staff. Like it's important that they still have some supervision and guidance, and that someone is double checking their work. And so sometimes when I think about who's double checking the AI work, it can be support staff, sometimes veterinarians. And I think we're going to see that these tools get better and better over the next few years. And if we can leverage them to do a lot of our busy work for us, what does that free us up to do? One of my favorite uses of AI tools is recognizing trends in data. So this is something that AI is really good at, is exporting shelter data and identifying trends. And this can be trends in disease. This can be trends in things like length of stay. You can upload a fairly large data set to ChatGPT or Copilot or whatever AI software you use. And it's pretty darn good at pulling out trends and interpreting data. And so finding ways to take some of the busy work off your plate and let AI do it, I think is a great way to expand your capacity. So I present this slide to you as the initial introduction to a shared care network. So when I think about a shelter, I think about all of the different ways we can engage different systems to provide medical care to the pets in our shelters. And so oftentimes in the beginning, shelters will use just one vet for all things. And I encourage, especially if you're in an area where there are lots of options, to explore like what a shared care network might look like. And so what this could mean is that for high quality, high volume spay neuter, you use one clinic or 5 or 6. And then you may have an MOU with an emergency clinic that has agreed to a budget or a treatment approach or how many pets they can see and when, to help facilitate some of that care. We may use rescue and shelter partnerships when we identify animals that are outside of the scope of what we can care for to get rapid placement. And I do think that some of those partnerships also can benefit from operating under an MOU. If a rescue can agree to take a certain number of medical cases per year, like starting to build that relationship and figure that out can be really helpful. You may have a vet of record who helps oversee your protocols and order medications and vaccines. That may be the same person that sees your sick and injured patients, or it may not. They may be a totally different person that may or may not live in your immediate community. Foster networks. Fosters can be incredible medical caretakers. And so I think when we think about foster and how we can expand our medical department, bringing those people in to help do some of our disease management, whether it's ringworm, or maybe it's distemper, or maybe it's neonatal kittens, how can we engage our foster base to help us take care of medical patients? Telehealth, it is here and it's here to stay for the most part in most places. So whether that is the use of triage over the phone with different veterinary groups or veterinary technicians, or whether it's a formalized telehealth service that helps do some of that, I think it is a valuable piece of a shared care network. And making sure that, once again, we're training our staff and volunteers to the highest level their license allows to ensure that we're leveraging everyone in our organization. So how can we utilize foster for expansion of medical care? I think I highlighted most of that on the last slide, but I wanted to make sure that I got its own slides, so that I didn't forget to talk about it. But I think the more we can train, empower, and trust our fosters, the more we can expand how many medical cases we can treat in a year. Okay, this is sometimes where we have to circle back to that question where I said I might say things that are different from what you're doing currently. And we want to think about what we would trade to be able to get every shelter animal in the country care. And so I propose there may be some things we can stop doing. I will also say that I could talk for an hour about almost every single one of these bullet points. And so I'm going to talk about them briefly, but there's definitely room for more conversation and more resources. So if any of these are something you are interested in learning more about, please send us an email. It'll be on the end of the slideshow, but it's just sheltermedicine@bestfriends.org, and we can dive into things deeper. One thing that comes up at almost every shelter we go to is the routine FIV, FELV testing of all healthy cats. And this is probably a movement most of you guys have heard about so far, but it's this idea that if we are testing all healthy cats and there's not that many positives in a general population, then we may be assigning results that aren't true to cats. And is there a better way we can spend our resources, whether it's staff time or financially? Routine fecal testing. So our general approach is we'd use broad spectrum deworming on intake, and that can help us get away from fecal testing. And also highlight in the same bucket goes a lot of diagnostics. So in the shelter, a lot of times our approach is empirically based and not necessarily based on extensive diagnostics. I love being able to reach person diagnostics when necessary, but really taking an analytical look at whether they're changing what we do. Holding, return to home, or TNVR cats for medical. We have some return to field guidelines that may be helpful for you guys. We do often release cats that have mild medical or that have a one-time intervention. We oftentimes do release them back into the field. So if that's something that's interesting to you, please reach out. Treating of asymptomatic conditions that resolve without intervention. Typically, the one I think about first with this is really mild feline upper respiratory. Repeated physical exams by a veterinarian. Isolation for feline URI. Holding animals for procedures, and whether this is holding animals for dentals or holding animals for other things, is that something we can stop doing? Unnecessary behavior evaluations, and prolonged hospitalization, or just in shelter care for conditions that can be managed in foster. Like I said, I could probably give an hour presentation on all of these. And so I hope this was just enough to stimulate conversation. And if you have questions or you want more information, or if you're wondering if that's something you should stop doing, send us an email. I think, well, I love this quote, an ounce of prevention is worth a pound of cure. So when I think about if I didn't have a veterinarian on site, or if I was trying to optimize my veterinarian's time, I think one of the most important things we can do is prevent animals from getting sick. And especially if we don't have access to a veterinarian, but also if we do have a veterinarian, there's a lot of other things we can do besides constantly playing catch up on infectious disease. So how do we do this? We do this by vaccinating on intake. Typically, shelters order vaccinations under a vet of record, but there are places shelters can get vaccinations even if they don't have a vet of record, and same with preventative care like dewormers. So if that's something you're interested in, please reach out. Included this any stage or status because oftentimes we get questions around, should I vaccinate this? And our answer is almost always yes. So just no matter if they are little tiny neonatal babies, no matter if they're sick, no matter if they're old, because we're balancing both individual health and population level health. Could also give an hour-long presentation on this, but that is our primary way of preventing disease in the shelter. PPE, so I hope you guys noticed in all of my very adorable pictures in this presentation that everyone was wearing gloves in all of them. And I'm very proud of that. But we need to be wearing gloves with everyone in the shelter. And if we're dealing with itty bitty babies, we add on gowns and shoe covers. By itty bitty babies, I mean under 5 months. So some of them are not that itty bitty anymore. And neither of those first two pieces require a veterinarian and can help us expand our ability to treat more animals. Reduce length of stay. So how do we minimize the number of days an animal is in the shelter so that they don't have the chance to get sick? And there are, once again, lots of strategies to do this. And we're going to talk about one on the next slide. And C4C, which is a fun little acronym to describe capacity for care. So by operating within our capacity for care and keeping our population at a level that is most beneficial to the animals and to the staff, we can prevent some of the disease within the shelter from happening. And there's lots of discussion to be had about this too. So I feel like a lot of this presentation is little tiny glimpses into things we can do. So if there's anything that you're interested in, please reach out. I know I keep saying that, but okay. I think it's impossible to give this presentation without talking about spay and neuter. And it's impossible to hear me talk without hear me talking about spay and neuter. Spay and neuter is something that I love very much. It is the primary piece of my work. It is something I'm very passionate about. So I want to give that disclaimer before I get into any of this. I also want to think back to that first slide where we talked about the spay and neuter backlog and that it's likely around 4 million surgeries right now. And so we're stuck with this problem, right? We have all these animals in our shelter and we need to get them all spayed and neutered to leave. And so we're presented with some options. And some of these may seem like new options to you, and some of these may be things you've already explored. Some things may sound like that's totally insane and I've lost it, but just hear me out. So when we think about spay and neuter, we have a couple options. So option one is we hold all animals in our facility until they are altered. So no one leaves the front door until they're altered. Option two is we retain legal custody until they're altered. So this includes things like foster to adopt, where they remain in your foster system until you can get one of those very sparse, sacred spay neuter appointments, either in your own clinic or at a local clinic or a high volume clinic. Option three is we adopt them out regardless of altered status. And we have them agree that they will get their pet spayed and neutered within a certain timeline. Some different municipalities have different timelines that allow for this. We have them sometimes make a deposit that says, give me some money, and when you get your pet spayed and neutered, I give you the money back. So those are some different strategies that exist. I left this question mark because I think that there are probably a lot of others that I don't know about or haven't thought about or that I haven't considered before. I will tell you there are shelters and organizations that do make a just verbal agreement that we think the pet should be spayed and neutered, and we hope that's something you will do. And that isn't a one size fits all. And there's lots of different regulations that determine which pathway you're going to go down. But I just kind of wanted to present all these options as things that exist and to consider. So when I think more about the spay or neuter dilemma, I want to present some of these facts, call them facts. What we know. So we know that when we reduce length of stay, we improve welfare and prevent disease dramatically. We know that places that do contracts, deposits, foster to adopt, any of those things, compliance is actually pretty good. And so I think oftentimes we're like, what if they don't come back? The data that's circulating around right now is like as high as 95%, depending on which strategy you use, but it can be quite high. I think this piece is really hard, and it's been hard, I think, for me for a long time. But when I look at the data, I know it to be true. So a small number of missed sterilizations does not drive community overpopulation. So if I think about 95% compliance, or even in the communities that don't have that high of compliance, even 80% compliance, and I think about what pets we're servicing, in any given community, the shelter may see 3 to 5% of the animals in that community. Most pets never enter the shelter, thank goodness. And I would like to see it even lower, but 3 to 5% of animals in a community enter the shelter. If we spayed and neutered them all, that would be 100% compliance, right? If that number dropped to 95 or 80%, we are likely talking about between 0.1 and 0.2% of the community not being spayed or neutered. When we think about what percentage of the community needs to be spayed or neutered to achieve population stabilization, even for a short while, we're typically talking about 80% or above. And so with all of this, I just encourage you to think about what opportunities we could take to get animals out of the shelter faster, and what solutions might work for our shelter, as far as, is foster to adopt a solution? Is a deposit a solution? Is a contract a solution? How can I get them out faster? And on the back end, we'll keep working on high quality, high volume spay neuter until every vet in the country can do 1,000 a day or something. Then the problem will be solved. Until then. And I think this piece is really important. So you'll hear us, and by us I mean best friends and me, talk about trusting your community. And so when I think about trusting my community and building community engagement and partnering in shared responsibility, I think this is one way we can show the community we trust them. And we can have those conversations, right? Okay. I'm going to skip back to this slide because we're almost out of time. What do vets want? This is what you all came for here. And so I wanted to go over a couple of papers that show kind of what shelter vets are looking for. And so Mel's gonna, I think I gave her the link to this one. Drop some of these in the chat as well, so you can look at more data if you're interested. When we looked at the top 3 factors that motivated veterinarians to serve as a vet of record, so this is where we're talking about staff vet, we're talking about vet of record. The top 3 motivations were to improve animal welfare, to help the community, and they wanted to do spay and neuter. So we're trying to appeal to a vet of record. That is potentially what they may be interested in. The primary concern identified by veterinarians were related to not trusting shelters to follow their veterinary advice. So when we think about this data of how we bring vets in, I think step 1 is we build trust with them. And step 2 is we give them some of what they want, right? They want to improve animal welfare. They want their community to be a good place to live. And some of them want to do surgery. I think also when I think about vet of record in particular, I think about how do I provide the vet of record, the little toolkit I have made to make it easy for a vet to be my vet of record. And I think this also helps build trust, right? So if you're approaching a vet to be your vet of record and you approach them with an MOU that is favorable to everyone, you approach them with a library of protocols that are supported by shelter medicine evidence, right? and you come prepared and you present that to however many veterinarians are in your county, or if you're not that lucky, or in your region, and see if anyone's interested in making that partnership with you. And I think really presenting it as a partnership can be one of the most valuable ways. When we look at what shelter vets want to be able to stay, here are some of the bullet points. So an unfortunate piece of data is when a group of shelter veterinarians was polled, 53% said they were going to leave in the next year. And so retention is the key here. So when surveyed, those veterinarians, they wanted flexible work hours, they wanted good culture, they wanted to be fun to come to work. They wanted the opportunity to develop their skills, and they wanted to be involved in leadership and decision making. And so if your vets are not currently involved in leadership and decision making, I encourage you to explore that soon and find a seat for them at the table, because it's something they want. Vet recruitment. So where do I find a vet? There's not very many around. According to the data. And some of this is really interesting data, right? Because it's not necessarily that, it doesn't appear to be that there's not enough vets coming out of vet school. It's that a lot of vets are leaving the field, and a lot of vets are leaving the shelter medicine field. So first of all, how do we keep the vets we already have, and we keep them in our field of shelter medicine? But if we need to find a vet, where do we look? And so the ASV job board is a shelter medicine specific job board. And so you might find that shelter vets, which are have a little different approach typically than a general practitioner, you might be able to find them there. Social media, and when I say social media, oftentimes it's Facebook. So shelter medicine specific Facebook groups exist, and there's lots of chat around there. And then other people can chime in. And that's a lot of vets want to see that other vets have worked there and it's a place they want to work. Conferences can be really helpful. That's where you get a bunch of vets in one room. Local recruitment, especially for veterinarian of record, going and introducing yourself to all the practices in your region. I say region because I live in a really rural part of the United States. And so I'm like, county isn't enough. But for some of you, even your direct neighborhood may be enough, depending on where you live. But local recruitment, especially for vet of record, if that's not something you have, or if you feel like your veterinary of record relationship isn't leveraged as far as it needs to be, getting out there in the community and meeting folks and seeing if you can present them with an agreement that works for everyone. Vet and vet tech schools. So recruitment of vets and vet techs before they graduate can be really helpful in creating an environment where it's helpful for them to learn. And that's all I've got for you guys. I think there's still a few minutes left. I have 2:54. Does that sound right, Mel?
Yep, that is right.
Is there
we
any?
can open it to questions then, if anybody has anything they'd like to ask.
Was there anything in the Q&A box I didn't see?
No.
Okay. Our email is up on the screen, sheltermedicine@bestfriends.org. And then the protocol link, we can put the links back into the chat. Mel, if you just want to put them all in one spot so they have them. The protocol link is in there, and it's going to take you through a request screen first, but that's just to help us kind of be able to help you and reach out to you in the future. But right after you fill out that request form, it'll take you straight to the protocols. Okay. Oh, we have a question. How do you make shelter medicine appealing to students and vet techs? I love this question. When I think about how we build a field that people want to join, like how do we make shelter medicine the most fun place to work? I think the first piece that we just have to acknowledge is we have to get close to the salaries that are being offered in general practice, and they don't have to match perfectly. We know that if we do a bunch of other things right, like we Um, we offer flexible work hours. We have good culture. We have opportunities for them to develop their skills. We make them feel like they're going to help their community. We know we believe in our work and our mission. That is all worth a lot. But I think we must acknowledge and look at salaries in general practice. And when we look at what new graduates are making, it's going to be hard to find a veterinarian for less than $130,000 in the United States. And I say that as just kind of the cold hard truth. Like we have to figure out a way to get there when we're talking about staff veterinarians. Salary is going to be important. But I think even if we can't get to that number, there's still other ways to bring in vets and vet techs into all of these different types of relationships. Oh, Becca's going to say something.
Oh no, yeah, no, I think that is great. I was just unmuting for that we have one question on the Q&A here, and I think that you would like to answer that this one once you are done.
Yeah, yeah. The only thing I think shelter medicine is the best job in the world. And so I think getting in front of a bunch of vet students and saying that is
Yeah.
really important. You know, like how do we get into vet and vet tech schools and show them how much fun we have, right? Like I got to show them my kitten sweater picture and all my cute puppies and kittens with gloves. Like we have so much fun. And I think shelter medicine vets and shelter medicine vet techs, they're just some of the coolest people I know. So
Definitely.
how do we show the students that?
We do have someone is asking here, do you encourage medical fosters for paralyzed or incontinent cats that come into the shelter?
Yeah.
Definitely.
There,
I knew you
yeah,
would get excited about answer this
I do.
one.
Yeah, I do. I mean, so I love this question. So when I think about what is allowed to go to foster, there's almost nothing I would exclude from that, right? So when I think about, let's take this specific example, paralyzed or incontinent animals, I think bringing fosters in to teach them those skills and to show them the quality of life these animals can have helps expand people's understanding of like what adoptable is. So I think this movement to move away from like you have to be perfect to be adoptable and uh to how do we match make a home for someone who wants that pet. And so I think there's with enough training, there's almost nothing I wouldn't send to foster.
Yeah, love that. How do you compete with corporations that buy out vet practices?
Whoo! Okay. I love this one. No, I do like this actually. So we think about competing with corporate America, I'm not sure it's something we should do in the sense that like I'm not sure we're not offering the same thing. And so I feel like figuring out where to highlight places we're different. I will tell you, like, there are so many veterinarians and veterinary technicians that do not want to work for corporate.
hmm
So it's not necessarily making us like them, it's highlighting all of the ways that we're different, right? And so I think by showing folks that there's another option, right, other than corporate practice, and showing them all the different ways we can help animals and help our community. And I think even just the community piece, right? Like one of the pieces of corporate medicine that can feel hard is that it's detached from the community in a way. And so highlighting all of these ways that we're involved with the community, we're improving animal welfare, we make a difference every day, and I'm not saying corporate practices don't, but I will say when we look back at like what vets wanted, right? They want like workplace culture, they want to make a difference, they want to improve animal welfare. So showing how we're different, I think, is the way we compete.
And I think what you said, like, but it's also the freedom, right? Like, there's a lot of like, with a lot of the corporations, also, you have a lot of protocols. You have a lot of you, they're very limited also what those vets can do as well. And even though in the clinic, in the shelters, we are talking about having protocols, having like established ways of doing things, but definitely it's far more uh, fun. And as you said, like, it's that you really doing far more and you have more freedom to make a difference there, really. I don't think we have more time. We do have a couple of questions that we haven't answered in the Q&A. Megan and Anne, if you want to send us an email on the shelter medicine, we definitely can answer you guys over email to make sure that we are answering your questions.
Thank you guys so much. I'll stop.